Assalamu alaikum. I am Dr. Tarafder Shahniam Ahmed, Associate Professor of Pharmacology, Bashundhara Ad-din Medical College, South Keraniganj, Dhaka. Dear students, welcome to my third lecture on drugs acting on the sympathetic nervous system. In the previous episode, we have discussed the basic knowledges regarding sympathomimetic drugs, their classification and indication of them. Today we shall discuss about their pharmacological effects or actions on different tissues and organs. So, let us start. What is the pharmacological effect of adrenaline or similar sympathomimetic drugs on heart? We know that adrenaline increases heart rate and cardiac output. There is beta 1 receptors on cardiac muscles. They cause positive chronotropic and positive inotropic effects and consecutively increase the heart rate and force of contraction, thereby increases the cardiac output and increases the systolic blood pressure. In the slide, I have shown these events in a flowchart very easily. You can write it down as such or in a descriptive manner in a paragraph. Then, what is their role on blood vessels? On blood vessels, there are alpha 1 receptors. So, adrenaline binds with these alpha 1 receptors. They are actually agonists on these receptors. They cause vasoconstriction, increase peripheral vascular resistance or PVR, increase venous return and increase diastolic blood pressure. During viva examination, most of you skip these steps. Please mind it, you should not skip and jump to the conclusion that adrenaline binds with alpha 1 receptor and increases blood pressure, causes vasoconstriction. But what are the middle steps? You should mention them, that it causes vasoconstriction, increases peripheral vascular resistance, increases venous return and which type of blood pressure? Either systolic or diastolic. Here they increase diastolic blood pressure. Furthermore, there are also beta 2 receptors present in skeletal muscle vasculature. As we have described previously, the sites of occurrence of different sympathetic receptors, you should remember. Adrenaline binds with beta 2 receptors of the skeletal muscle vasculature, causes vasodilation, decreases peripheral vascular resistance and decreases diastolic blood pressure. So, these two effects, alpha 1 effect and beta 2 effects, are quite opposite of each other, but alpha 1 effect is predominant than beta 2 effect. So, the net result is slight increase in diastolic blood pressure. The most important is their role on kidney, role of adrenaline or other sympathomimetic drugs on kidney. Adrenaline is an agonist and binds with the beta 1 receptors of myoepithelial cells present in juxtaglomerular apparatus of kidney. Thus, they produce or increase renin secretion. Renin acts enzymatically on angiotensinogen, which is produced from the liver. Angiotensinogen is converted to angiotensin 1 and angiotensin 1 is again converted to angiotensin 2. This conversion is caused by angiotensin converting enzyme derived from endothelium of lung vessels. Angiotensin 2 has two types of action, immediate and long term. Immediately they cause vasoconstriction, which is very powerful vasoconstrictor. increase peripheral vascular resistance and increase venous return, and as I said, thus they increase diastolic blood pressure. In long term effect, angiotensin II causes the production and secretion of aldosterone from adrenal glands. Aldosterone is a mineralocorticoid. It causes the reabsorption of salt and water by collecting tubules of kidney, increases the extracellular fluid volume, increases blood volume and increases overall blood pressure. So, if asked the role of adrenaline or XYZ sympathomimetic drugs on cardiovascular system, you should mention the effects of on heart and blood vessel. If asked how does adrenaline increase blood pressure, you should mention all the three tissues: heart, blood vessel and kidney. Then we should discuss the role of sympathomimetic drugs on respiratory tract. We know that salbutamol is a specific beta 2 agonist and adrenaline is a generalized or non-selective beta 2 agonist. So, salbutamol or adrenaline or other drugs, those are agonists, they bind to or agonizes the beta 2 receptor of the bronchial smooth muscle, stimulates adenylyl cyclase enzyme, increase the production of cyclic AMP. What happens is cyclic AMP becomes activated and it also activates the protein kinase A, and there is phosphorylation of myosin light chain kinase. This phosphorylation of myosin light chain kinase, there is the calcium and calmodulin complex which cannot act on phosphorylated myosin light chain. So, therefore, there is relaxation of the bronchial smooth muscle and ultimately bronchodilation. There is relief of bronchial asthma. That is why we use salbutamol as anti-bronchial asthma drug. Then what are the effects of these drugs on central nervous system? The non-catecholamines such as amphetamine can cross the blood brain barrier and cause mood elevation, alertness, euphoria, insomnia, anorexia, and as we all know that methylamphetamine, commonly known as yaba, is a drug of abuse. All right. What are the effects of these drugs on eye? Phenylephrine, which is a alpha 1 receptor agonist, binds with this alpha 1 receptor of the radial muscle of iris, causes contraction of the radial muscles, causes pupillary dilation, which is also known as mydriasis. And adrenaline stimulates the beta receptors of ciliary epithelium, increases the production of aqueous humor, increase intraocular pressure and causes glaucoma. There is a figure of anatomy of iris and pupil in the slide. Please study them. A very clear and descriptive picture. There is also this figure from your textbook Katzung, the anatomy of the anterior chamber and the production of aqueous humor and its drainage. Study this figure from your textbook. This is very important for your examination. The next slide is showing the effects of clonidine on GIT, gastrointestinal tract. Clonidine, it is an agonist at presynaptic alpha 2 heteroreceptors reduce the release of acetylcholine by negative feedback mechanism, and acetylcholine mediated contraction of gut wall is inhibited. So, there is decreased peristalsis and ultimately constipation. On genitourinary tract, adrenaline is a stimulator on beta 2 receptors of uterine smooth muscles. There is relaxation of uterus and retains the product of conception. In case of bladder wall, the detrusor muscle contains beta 2 receptors and adrenaline is a agonist, and there is retention of urine. In the next slide, we shall discuss the role of sympathomimetic drugs on exocrine glands. Most sympathomimetics except clonidine promotes salivary secretion, and in case of apocrine sweat glands of our palm, which are actually non-thermoregulatory sweat glands, adrenaline produces increased sweat production, whereas acetylcholine acts on the muscarinic type 3 receptors and the ecrine or thermoregulatory sweat glands, they increase sweat production. So, in case of thermoregulatory sweat glands, the muscarinic 3 receptors come into action and the agonist drug is acetylcholine. In case of non-thermoregulatory sweat glands of palm and sole, adrenaline comes into action. What are the metabolic effects of adrenaline? Adrenaline binds with beta 3 receptors in the fat cells, causes lipolysis, release of fatty acid, free fatty acid into the circulation, and in case of skeletal muscles, activation of beta 2 receptors by sympathomimetic drugs causes activation of the enzyme glycogen phosphorylase, thereby increase glycogenolysis and gluconeogenesis. The ultimate or net result is increased blood glucose level. Also, on blood glucose level, actually how does adrenaline or similar drugs increase blood glucose level and help in case of hypoglycemic shock or other kind of shocks? Adrenaline acts on the beta 2 receptors in the liver, activate the enzyme glycogen phosphorylase, increase glycogenolysis and gluconeogenesis, increase blood glucose level. It also acts on the alpha 1 receptors of the pancreatic beta cells, decrease insulin release and increase blood glucose level, as well as on the pancreatic alpha cells there are beta 2 receptors, and adrenaline increase glucagon release by stimulating these receptors and also increases the blood glucose level. So, adrenaline increases blood glucose level by these 3 mechanisms. Hope you are clear about these steps. So, this was all for today. We shall discuss furthermore on our next episode. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.